All right. Now, in this question, again, we have an incomplete sentence. So, this guideline extract for MRI referrals stresses the need to do something. Okay. Well, it stresses the need to ask specific questions to patients before referring them. Here, I have two problems in this answer option. It says that the questions should be asked to patients. But in my paragraph, I think they have talked about that talking to a radiologist about a patient, not to a patient, but talking to a radiologist about a patient prior to referral. Prior to referral means that before their referral may help to determine the most appropriate imaging. Again, in the very first sentence, they say that GPs can actually expect more relevant, clinically relevant reports. That means if they are more clinically relevant, they are more clinically accurate, right? So they are more appropriate. This word is being used. When they ask specific clinical questions, so they cannot ask specific clinical questions to patients here, because when I read on, they say that they ask specific clinical questions and provide a diagnosis or differential diagnosis based on clinical findings in the referral request. So when they are making the referral request, to whom they are making the referral request, maybe the radiologist, maybe a neurologist, maybe another healthcare specialist. So to those people, they should be providing an appropriate diagnosis or a differential diagnosis, and they should be asking appropriate clinical questions to them, and they should again be providing clinically relevant information to them. So we are not asking the questions to patients, and we are definitely not asking those questions to them before referring them. So this is the reason why answer option A is going to be incorrect. Or answer option B, that provide and request specific information for results accuracy. This actually is the right answer, because I don't have literally any problem with this answer option. For results accuracy, yes. When we talk about clinically relevant reports, that's what we mean. And for most appropriate imaging, then again, this is what we mean, or imaging to be more appropriate, right? If you read on this example, it is also saying the same thing, that when requesting this or that, providing information. So providing information that the patient has this or that problem or suspected this problem, to assist the person in providing a more specific and helpful report. More specific means that it is going to be easy for us to determine. So result is going to be more accurate according to our expectations. So answer option B, according to me, is actually the right answer. I don't have any problem with this. Sorry about that. This should be the right answer, but I'm not going to choose this to be the right answer just yet. If I go to answer option C, then it says that we should use MRI referral stresses the need to use contrast for plain imaging. The word contrast and plain imaging is being used in the paragraph. That is true. But according to the sentence, MRI referrals emphasize the need to use contrast, that you should be using contrast when you are doing plain imaging. Please use contrast. Based on the entire paragraph, I don't really understand how they are focusing on the type of imaging they should be doing and the material or ingredient they should be using for the imaging. The line which does talk about this is this. This includes the use of contrast, but this is only in relation to the radiologist here, right? Referral request could be made to anyone else. This is only an example. So the MRI referral, this particular guideline, is actually not focusing only on radiologists, right? So it is only not talking about contrast here. Then again, we see that note that while the contrast may be requested by the referring clinician, so the person who has requested the referral or patient, the person who has done the referral, okay, let's say that I'm the GP, I have actually done the referral, right? So let's assume that I want the radiologist to use the contrast in the imaging. But according to the sentence, it means that contrast studies may not always be done. They should not always be done, or they might not always be done if the radiologist feels that plain imaging is more appropriate. So it means if you're doing plain imaging, then contrast will not be used. If that is the case, it is the opposite of us saying that you should definitely use contrast for plain imaging. So the entire statement is incorrect here, because even though they are using the same words from the paragraph, the meaning is completely different, which is a very common trick which is used in your multiple choice questions, to use the same words from the paragraph in the answer option. This makes a student who is very confused about a sentence's meaning choose that answer option. So try not to choose the answer options which have the same words, but rather check their meaning. Do they have the same meaning as the answer option? And if they have the same meaning as the answer option, then they have the same meaning as the answer option, then you should check whether or not that actually answers the question. Okay. So here our answer option B is going to be the right answer. Now, from the previous question, there are a few words that you may or may not understand. If you already know them, then that's very good. But if you don't know them, then please understand these words are going to be used again and again in your OET in all the four modules. So you should be aware of their meaning. The definitions are right in front of you. If you want to take a screenshot, pause the video and write them down. But let me explain what is the difference between diagnosis and saying differential diagnosis. Doctors often use this when they write their answers when in OET writing letter. And diagnosis means that this is the problem that I have identified you with. If I say that you are diagnosed with pneumonia, that means you have pneumonia. But if I say that I have made the differential diagnosis of pneumonia, then it means that right now this is the condition which I think you will most probably have. I have not yet confirmed this condition, and I need to conduct further tests to confirm this condition. So, in other words, I can also say that it is a suspected condition. Another word that you should be aware of, either if, even if you are a nurse, or if you are a doctor, or if you are any other healthcare professional, if you write OET letters, then you are going to say this word suspect again and again and again in your case notes. Okay. So suspect also means that it is not yet confirmed, which is why when you write your letters, you should not say that I'm writing to refer this patient who has been diagnosed with this condition or who has this condition. Why? Because they have not yet been confirmed to have this condition. We say, I'm writing to refer this patient who has suspected so and so problem, who has suspected pneumonia, who has suspected gastroenteritis. Okay. Another word that is used in OET is the word prior to. The word prior to actually means before something or preceding something. And this is used to establish timeline in your OET letters and in your OET speaking as well. But in your OET speaking, you don't really use the word prior to when you're talking to the patient, but the speaking role play card can actually contain that word. So you should know the meaning. And in your OET writing, you actually use this word when you want to establish sometimes timelines that require this word in your OET letter writing. And sometimes when you're giving guidelines to the person, or when we are actually writing to a person who is going to be aware of this word, then we can use this as well. So when I say, for example, please fast for at least 8 hours prior to your scheduled blood test, that means before your scheduled blood test, at least 8 hours before, I want you to start fasting. Okay. Now, progressive is another word which is very commonly used in medical context, and it means that something is getting worse over time, or maybe it is becoming even more severe gradually, slowly. Okay. So this can be used with symptoms. You can have progressive arthritis with medical condition. You can have progressive pain. That means with time, the pain is increasing. You can say that if I have progressive arthritis, that means over time it is actually becoming worse. So these words are commonly used when it comes to your OET writing. All right. So for this question, we have again a policy document, and it wants us to basically understand what does this paragraph of policy tells us about the test results that are being discussed. Now, right away, I know that answer option A is going to be incorrect. The reason why answer option A is going to be incorrect is for two reasons, actually. Number one, in the paragraph of the policy document, I see that if a nurse is made aware of abnormal test results, then she is expected to notify the credentialed specialist, the person who has actually requested the test results. She is supposed to be informing that person. Then, any abnormal test results, whichever are, then they are supposed to be highlighted in the patient's progress notes. So, two things here. If a nurse becomes aware that a patient has abnormal test results, then they should inform the person who has requested the test results or the specialist about them. And these test results then should be mentioned in the patient progress notes. The problem with this answer option A now is that here it says that the patients should be made aware of the abnormal test results. Unfortunately, there is no sentence which actually says that patients should be made aware of the abnormal test results. Now, the funny thing here is that many students are going to select answer A, option A to be the right answer right away because answer option A is something that generally happens in their life. Whenever there are any kind of test results which are not normal, they are obviously informed to the patient. But in your OET reading part B and C, you should not select an answer option based on your real life experience, based on your job responsibilities, based on your medical knowledge. Instead, you should be selecting the right answer option based on the information which is provided in the paragraph. And sometimes, based on that paragraph, there is implied meaning as well. But anytime that is the case, you should be always able to point to a particular sentence and say that because of this sentence, my answer option A is correct. Because of this, my answer option A is incorrect. And here in this case, it is clear that the answer option A is going to be incorrect for this reason because the paragraph does not actually talk about patients receiving these test results. So, moving on to the second question, that nurses should inform the requesting specialist about the results. Here, I have problem with the word results. In the question, they have mentioned about test results. Here also, they have mentioned test results, but they have not specified which test results. They have not specified that we are talking about abnormal test results or normal test results. So it could be very well referring to all kinds of test results. Now, why that is a problem? Because in my paragraph, specifically, I see that they are mentioning that if a nurse is made aware of what kind of results, abnormal results, then she is expected to notify the credential specialist. Moreover, it is not mentioned in my paragraph that she is supposed to be notifying the credential specialist via the internet, which is mentioned in my answer option B. The internet part is only discussed in another paragraph, which is here, that the results or the test results are accessible on demand via the internet. So basically, on demand, if you want to, you can access those test results whenever you want. On demand is basically what it means, that if you say now, then you will get those test results now. So on the internet, they are available in electronic form. That means in the PDF form, maybe Word form. Okay. So because I have a problem with answer option A clearly highlighted and in answer option B as well, clearly my answer option C is going to be the right answer here. But at the same time, I can see when results are available, once they are made available, they can be accessed anytime online. They can be accessed online. Yes. They can be accessed anytime on demand. Yes. So because of those words, my answer is going to be correct here. That is answer option C. Now, one thing, if you are not aware of what is abnormal result, it actually means the test findings which fall outside of the expected or normal range for a given parameter or condition. So all in all, it means that it is something which is important for your healthcare professional to know, or it is important for your health as well. In your OET writing, we use the term abnormal results a lot. Whether you're a doctor or a nurse or any other healthcare professional, you are going to use this word. So here are a few examples that you can study which use the word abnormal results. All right. You can take a screenshot or pause the video for your better understanding. All right. So here the questions asks me basically, so what is the purpose of these guidelines? What are they reminding the staff about? Reminding the staff about does not necessarily mean that they are going to say, hey, there's a reminder. Don't think that that is going to be so direct. Remind the staff about is just a fancy way of saying that basically when you read this paragraph, these bullet points, what do you understand, what you should be aware of? Okay. And when we ask about the purpose of any sentence or anything at all, we do not want to focus on what is given exactly, but we want to focus on how can we utilize this information, in which way, why would I choose to write this information, what do I want you to understand with the help of this information. So it is not directly the same thing which is written here, but rather the purpose of it overall. Okay. So the first answer option says that the purpose of these guidelines is to remind staff to obtain verbal consent before collecting a patient's history. So they have written all of this information so that they can remind you that, listen, you should take a patient's consent, their permission, before you start asking them questions about their health. Now, unfortunately, I do not believe this because the very first thing they are telling me here in the bullet point is that verbal consent is to be obtained prior to, I told you this word will be used again and again. So, prior to means before any interview. Interview is simply you asking question to another person. Don't think it is a job interview or something as formal. So prior to any interview about the patient's health history, only relevant information should be collected. But apart from this, do I see anything about permission in this sentence? No. Do I see this here? No. Do I see this here? Anything about permission? No, I don't see it. Do I see this here? No, I do not see the part about getting verbal consent from the patient from literally any other sentence. This is just a minor detail in the rest of this paragraph. So the point of writing this sentence maybe is to inform us that we should be taking the consent, but I cannot accept that that is the point of this entire paragraph. This is only one small detail which is accurate about the paragraph, but is not the whole purpose of the paragraph. Let's understand that. Okay. So this I'm going to mark as incorrect based on this. Then for answer option B, what do I see? That we should ensure, or it reminds staff to ensure the privacy of the patient. Again, the same reasoning. I see that only here. Privacy, right? That the nurse shall maintain the privacy as much as is practicable, which may include taking the patient to another room. So the thing with this sentence also is that this privacy part again is not mentioned literally anywhere else. This is just a small point of obtaining the nursing history. And why do we actually obtain the nursing history? Why have I written these bullet points? Is because of this. The nursing assessment, because the clinical records, it's based on the nursing assessment, be it in electronic form or in a hard copy. It aids means it helps you. Okay, it helps you in planning the patient care. What should be provided to the patient, identifying their special need, if they have any special needs which is not the same as other patients, if they are at any risks during hospitalization, maybe due to their weight, due to their allergies, due to their existing medical conditions, or during discharge because they have dizziness, because they have not recovered completely. Anything, it should be done as soon as possible. Promptly means very quickly, and signed and dated either before admission, before the patient is admitted, or shortly after, as soon as possible, basically. So they have written all of these points about information collection to basically tell you that, listen, history collection is an important part. Why? Because it helps you in all of these. So that is the reason why your answer option C is going to be the correct answer, that ensure patients receive the right care. Right care, why? Because if I'm not aware of their special needs, then I might not provide them that particular thing that they need at that time. For example, if I need a wheelchair or a walker to walk around because that is my need and you are not aware of that, then you may not be able to provide me the right care. So this is basically a very general way of saying this is the whole point of these particular points they have made in the paragraph. So just because something is accurate from the paragraph, you should double check, does it even answer the question that has been asked to you? So here, answer option A and B are correct according to the paragraph, but do not answer the question, which is why it is going to be incorrect. All right. So for this question, it asks me, what is the main point of the guidelines? Is it to inform the hospital staff about the steps for transferring the patients to a long-term care facility? Whenever you're looking at any sentence, always pay attention to the adjectives or the adverbs they are using. If you don't know about adjectives or adverbs, you should look them up on the internet. But in a very simple definition, adjectives are words which give us more information about a noun. So, for example, here look at the word long term care before the word facility. Facility is a noun, it is the name of a place where you provide some sort of services, right? And what kind of facility are we talking about? Long term care facility. What does it mean? That the patient is going to receive treatment here or services here for a very long period. According to this answer option, it means that the guidelines, the main point, the main idea of these guidelines is to remind the hospital staff, inform them that what are the steps that you can follow to transfer your patient to a long-term care facility. Unfortunately, they have talked about long-term care facility only here, and they have added only 2 points here, only 2 points, which say that the relevant notes which need to be photocopied. They have not even mentioned which are the relevant notes, by the way. Track data will be completed prior to discharge. How do you complete the track data? How exactly? What is included in the track data? Is there any other step that is being followed? No. So they have not really told me the steps which are there for transferring the patient. They've told me two of the many things that would be there, but they have not told me all the steps which are needed for us to actually understand to transfer the patient to a long term care facility. Now, some students might say that, ma'am, they are not saying that all the steps for transferring the patient to a long-term care facility are mentioned in the paragraph. So some steps are mentioned. So steps are mentioned. So why can't we choose answer option A? It is because of this word, main point. Main point means what is the main idea? When you think of the main idea, you do not think of very small details. Again, just like the last question, very minute details will never be the main idea. Main idea is going to be something that is discussed again and again, or that is discussed for most part of the paragraph, because that is important. That is the main idea, which is why we are discussing it again and again, or for most of the time. So here we see that most of the paragraph is actually talking about acute transfer. What do we mean by that? Acute actually means short, short term. So acute transfer, that means the patient is going to be transferred for only a short period of time, maybe to receive only treatment, which is going to be there for temporary basis, not for a long period of time. When you transfer the patient for short-term treatment to another hospital, then these are the process or these are the steps that you need to follow. So according to this, I think my answer option C should be correct. The procedure for transferring patient for short-term treatment. Don't be fooled by the word treatment and the word transfer here. Because when you say acute transfer, it means the patient is being transferred for short period of time to another hospital. Patients do not go to hospital for vacations. If they had mentioned anything apart from hospital, maybe a facility, maybe somewhere else, right? I could then say, oh, they could be going to another area for a short period of time for n number of reasons, right? But the patient who goes to another hospital, they are going to receive treatment there. Acute transfer, that means for short term treatment, for short period of treatment, for short period of time, which is why my answer option C is actually going to be correct, because all of these bullet points are the procedural steps for this. The reason why my answer option B is going to be incorrect is because of the same reason as answer option A. The process for completing the track data before the patient is even discharged is actually not discussed anywhere in the paragraph. The only time they have mentioned the track data are these two areas when I see track data, but they have not mentioned how to complete it. What are the procedural steps? All track data must be completed prior to discharge. Yes, it must be completed prior to discharge. Yes, but how do we complete it? What are the procedural steps here? Sorry, here, the process for that. That is not given, which is why answer option B is going to be incorrect, A is going to be incorrect, and your answer option C is going to be the right answer. All right. So right away, one option that I can identify from the rest of the paragraph is GPs. Whenever I have any word which is the same as the paragraph, this is what I do. I don't choose it to be the right answer, but rather I go to the sentence which contains that word from the answer option and I check their meaning. If the meaning is similar, then I check whether the answer option with the same meaning as the paragraph actually answers my question or not. So here, that is the first thing I'm doing. I have the word GP here, and this is the only part of the paragraph which contains the word GP. So this should be easy for me to identify whether answer option B is correct or wrong. According to the question, the policy document recommends that the patient be given information by GPs. That means the patient should be given information by their GPs about what should they be given information about? Basically about monitoring early signs of cancers, plural, cancers, plural. Here, the sentence actually says that the patient's own GP, that means their own GP, will be informed that they have, will also be informed. That means we are also going to be informing the patient's GP that that means the patient, has actually reached their maximum lifetime number of visits and their accumulative total number of joules. Basically, I don't know what is joules. My answer options don't talk about joules. My question does not talk about joules, so I'm not going to worry about it. So the total number of joules, so that, why would they be told about this? So that they can monitor for early signs of skin cancer. Who's going to be informed? Patient's GP. If the patient's GP is going to be informed, then whose number of joules are we talking about? The patients, so that they can monitor for, remember, who can monitor for early signs of skin cancer? The GP. Some students might think, ma'am, I'm very confused with the words there which are being used again and again. For example, here they have used they, Here they have used they, here they have used they, right? So you might be confused about that, but think about the meaning of the sentence. Why would you inform the GP to then make the point that the patient is supposed to be monitoring? If the patient is supposed to be monitoring, you inform the patient, he will start monitoring for early signs of cancer. But if you are actually informing the GP, it's because the GP is going to be, with the help of regular visits, going to monitor for early signs of cancer. So that is my fix or trick for you to actually identify the meaning when you're confused because of the pronouns here. But here the answer option B says that patients should be given information by their GPs about monitoring early signs of cancer. That means GPs should give their patients information about how they, the patients, can monitor for early signs of cancer, which according to the sentence is incorrect. So this is why our answer option B is going to be the wrong answer option here, because I found a mistake here. Now I see the word phototherapy being used again and again, so it's not really helping me. I do see the part about maximum number of visits being used not everywhere, but in some areas. For example, here they talked about the maximum number of visits. And what does it option say? So it option says that patients should be given information about the maximum number of visits allowed for phototherapy treatment. So it's very simple. It says that whatever are the maximum number of visits which are allowed for phototherapy treatment, patients should be given information about that. And that information is the thing that we are reminding with this policy document. Here, they are not saying that the patients should be reminded about that, but instead they are saying that the GPs should be reminded of that. So I'm going to leave it. It's not helping me. Then I see this maximum life visits again here as well, that patients, those ones who have reached their maximum lifetime visits for this and that, they are at an increased risk of developing so and so cancer. But they are not telling me that I should inform them about their maximum number of visits. Then again, all the patients, not just these, all patients will be in the future made aware of. Again, remember, it is mentioned here also an increased risk of developing melanoma skin cancer. It is mentioned here also increased risk of skin cancer. Skin cancer is another word for non-melanoma skin cancer due to phototherapy. Prior to, this is the third question that is using the word prior to commencing treatment. They're not informing the patient or reminding the patient about how many maximum visits they will be allowed, but rather they are again and again informing them of the risk or the increased risk of developing skin cancer or developing a specific type of cancer, that is the melanoma, non-melanoma skin cancer, before starting the treatment. And this should be discussed again as the cumulative number of visits increases. So here also they have used the word accumulative number. That is total number of, not maximum. Accumulative does not mean maximum. So as the number of visits, total number of visits keep on increasing, you should again remind the patients about this. So here again, they're not focusing on actually informing the person about the maximum number of visits, but informing them about this increased risk of skin cancer. Following the patient's final appointment, when they have reached this, they will be offered this, but nowhere in the paragraph are they actually saying that they should be informed about these things, which is why our answer option A is going to be incorrect. And based on this, based on what we have read so far, you should be able to guess, yes, answer option C is actually the right answer, that patients should be given information about the increased risks. What are the increased risks? Oh, you can develop cancer, you can develop non-melanoma cancer. This should be discussed again and again due to phototherapy, the problems that they can encounter. So that's the reason. Clearly, this is the right answer. However, never, 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 never choose the right answer right away. Always eliminate the wrong answer options first before going to the right answer. Even if you have found your right answer, please eliminate your wrong answers, because the language of the right answer compared to another answer could be more accurate. Remember that. And just because an answer option exactly matches the meaning of a sentence from the paragraph does not make it a right answer. Remember, even if you match the meaning with a sentence from the paragraph, you should check whether or not that paragraph actually answers the question which has been asked. For example, the paragraph could be saying Monica likes cakes. Answer option B could be saying that Monica loves cakes. That's perfectly fine. But is the question asking what does Monica like? No. The question, if it asks that what does Monica teach, which is OET. So it should not be discussing what she likes or what she loves. Okay. Remember to check your answers for these things. That's about it for today's video. Thank you for watching.